when I was in my bachelor's program, and I was already a nurse through an associate degree program, and when we were always asking the question, a friend of mine and myself, well, what makes nursing different than medicine? And it just seemed to open up the floodgates for me when I first was exposed to nursing diagnosis, that this is one way to explain what's the difference between nursing and medicine. The big advantage is that you're naming the phenomena of concern. The theory that I really like is Hayakawa. He started writing about the need to name things back in 1939, so it's a very old vision, but he says that classifications is the way he put it is, classifications are a great step forward for any scientific discipline because they're enable you to standardize the names across people. So if I say fear, fear has a specific definition. Powerlessness, ineffective airway clearance, they all have specific definitions. So if I say it to you, you can understand me. Whereas if we don't use nursing diagnosis classifications, we don't have standardization of meanings.
When we have and use NANDA-diagnoses in our care plans, in interdisciplinary care plans, when we place a definition and the defining characteristics right there in the computer on the care plan to say, okay, this is the label, this is the title of the diagnosis, but this is what it actually means. And these are the characteristics that makes this diagnosis applicable to that patient. I think that really helps them understand it. I also think that if they look at the nursing care plans and they look at the definitions of, like I said, NANDA, but they also look at the definitions of the outcome and the indicators and the rating scale, they'd actually see more of a global picture of what nursing does.